Okay, welcome everyone to the PFCC Partners Community of Practice Workshop. I am so glad to see all of you here with us on this Friday afternoon. I hope it's a good one for all of you. A few reminders as we get started. Libby Hoy and I will be presenting the majority of our workshop today. So as we are presenting, if you have any questions, please utilize that chat box. I see a lot of people already have, so thank you so much. Please put any questions or comments in there, and we will be on there to kind of monitor the chat, answer any questions that we can. But we do have about 10 to 15 minutes at the end of our presentation today to have a Q&A. At that time, if you would like to come off mute, you can click the raise hand button that can be found on your Zoom toolbar. If you go to your Zoom toolbar, there should be an option that says reactions. And when you click that, you can click raise hand, and that will let us know that you would like to come off mute and join in on the conversation. On that toolbar, you can also find your mute and unmute button, your video button, and the chat, of course, as well. And if you have any questions, please, again, put those in the chat, and our team on there will be happy to help. As I mentioned, I am Lindsay Galley. I'm the Director of Education at PFCC Partners, and today we are really excited to talk to you about indicators of readiness for patient-family engagement for equity. Our organization has developed and used a tool, the Readiness Tool, for quite some time, and recently made some much needed updates. And so we're really excited to share all that we have learned with the DEI Leadership Council with you, and looking forward to getting to your questions as well. And our organization, PFCC Partners, we have a mission to center the inclusive human experience of health, reinvent through radical collaboration, be a catalyst for system transformation. And what we want to see in the next 20 years is a health system transformed, and one that works with people and through communities as a partner in their well-being. Our values are also included here, and you will see these values represented throughout our presentation today and in the Readiness Tool. So really a focus on equity, inclusion, diversity, collaboration, and solution focus. Our organization, PFCC Partners, fully supports the PFA network, or the Patient Family Advisor Network. This is a network for patients and family caregivers who are using their lived experiences to inform healthcare. So created by patient family advisors as well. By participating in the network, you have the opportunity to join a multitude of engagement opportunities that healthcare organizations come to us with.
I need to access the
meet the community of patient family advisors, connect with the community, get to know one another, and learn from each other, as well as in those skills development opportunities that we have. We actually call them skills exchanges, really an opportunity of sharing what we learn, asking questions, and really learning how to be an impactful and effective partner for change. So at this time, I would like to pass it off to Libby Hoy. Libby Hoy is the founder and CEO of PFCC Partners, and will be walking us through some definitions and background as we gear up to then look at some of the indicators of readiness that are found on the Readiness Tool, which I will also ask Laura Jackson from our team, Director of Communities, to post the link to that tool in the chat box. So at this time, I will pass it off to Libby.
Thank you, Lindsay, and thanks to everybody who's joined us today. It's always so great to just build the sense of community around patient-family engagement. This is an ever-evolving field, and the more we learn from one another, the more we can progress forward. And that's one of the reasons that we make tools like this and sessions like this available at no charge, because we really want people to invest their time and their energy in building really meaningful patient-family engagement. So at PFCC Partners, we believe strongly in creating infrastructure under partnerships with patient-family partners. We really have found the value of implementing infrastructure across these activities. And so the Readiness Tool kind of builds out from that desire for meaningful, or for structure, I should say, for meaningful partnerships. And I'm really excited to share the tool with you. I think we've, as Lindsay mentioned, we've used this tool for with hundreds of organizations to help implement patient and family advisory programs. But really with the newer DEI lens, or more focused DEI lens, and our DEI partners helping us, we think that the tool is very improved, so that we're really creating a pathway, if you will, for diversity and inclusion in our patient and family engagement efforts. So on the next slide, I'm just going to do a little bit of level setting, so we're all on the same page, because there's so much terminology floating around in the atmosphere around patient-family engagement, patient experience, patient-centered care. So I'm just going to let you know how we as an organization organize these concepts for ourselves, and that'll give you a good foundation for our conversation today. So we look at patient and family-centered or person-centered care as the model of care. It's really the noun, or the culture of care that the health system in the US is really trying to move towards. So it's, again, that kind of noun. If patient family-centered care is the noun, then patient-family engagement we see as the verb. We see it as an active strategy for designing, improving, evaluating our health system. So it's the partnership between patients and families and health systems, health policymakers, everyone. It's that active interaction that creates a strategy forward, so that we're creating inclusive outcomes, really benefiting all people. So if you think about patient-family engagement as an active strategy to improve our outcomes, then you can apply it to anything that you're working on. So you might be a research team looking at a particular disease state. So you can apply the engagement of patients and families into that research to improve the outcomes of that research project. You might be a rural health hospital, and you might apply those partnerships with your community to understand the needs of your community a little bit better and improve outcomes. Within a hospital setting, you might be working on patient safety programs, such as reducing sepsis or reducing readmissions. I know lots of organizations working on that. Well, how then do we apply that active strategy? We interview some families that are some patients and family caregivers who have been readmitted, and we get that insight as additional information to feed our improvement and our improvement efforts, I should say. So I want to just make mention too, though, there's a lot of conflation around the term patient-family engagement and patient experience. And so for us, again, in thinking about patient-family engagement as that active partnership, that can be applied to improving patient experience, absolutely. But it's not the same thing. And when we limit patient-family engagement as a strategy only for patient experience outcomes, then we miss this whole opportunity to embed patient-family engagement in quality improvement, in creating safer healthcare outcomes, in creating healthcare outcomes that are more equitable, or research teams. All of the stakeholders of healthcare really can benefit from applying patient-family engagement as an active strategy. On the next slide, we really, I've been doing this work for a long time. I started on my first Patient Family Advisory Council in 1995. So been doing this for a really long time, when we were really not so effective in our role, which is so exciting to see the progress. But in the last few years, we've really learned what it means to have patient family advisory councils that accurately reflect the population you're serving. I've said that statement for 10 years. And as we've started patient family advisory programs, we always said to the hospitals we were working with, your PFACs really need to reflect the population that you serve. We kind of left that conversation there. We're not leaving that conversation there anymore. So we really want to create pathways forward for more representation, more diversity to be included in these efforts. So we really want to understand and make accessible patient-family engagement to all of our community. All right, so what is, on the next slide, what is meaningful engagement? If you guys have not seen this report from the National Academy of Medicine, I highly, highly, highly recommend that you download it today. The link is there at the bottom. But when we're thinking about what is patient, family caregiver, really meaningful community engagement, it means working collaboratively with and through people that have similar situations, like being a hospital patient, similar concerns and similar challenges. So how do we know when we've got meaningful engagement? It's not about our metrics of what did we get out of the partnership as health systems, but do the communities feel engaged? And so this is really, again, expanding our vision of the power of patient-family engagement as a strategy, and more resources, more studies, more subject matter experts emerging all the time to really help us advance our practice of patient-family engagement. On the next slide, I wanted to share some of the folks that PFCC Partners has partnered with over the last, we've been open for 11 years. This is just a snippet of them. But what I wanted to share is this list consists of quality improvement organizations, federal quality improvement programs. It consists of rural health hospitals and large health systems and large academic systems. Also, measure developers, policymakers, nonprofit funders of this kind of work. Definitely researchers very involved with PCORI. So the point of all of that is to say, no matter what kind of project or program you're involved in, if you want to create effective partnerships with patients and families who are benefiting from the outcomes of your work, following a path that provides infrastructure is going to be, it can be applied to any of the activities across healthcare. That, I guess that's our point, is this readiness tool will help you no matter who you are or what kind of a project you're working on, or whether you're in a hospital or health system. The concepts of what goes into being ready and prepared for onboarding patient family advisors is applicable sort of no matter what you're doing. All right, so anyone who knows PFCC Partners knows that we talk ad nauseum about infrastructure. So on the next slide, why are we so committed to infrastructure? Because, I served on PFACs a long time before they were really integrated into a health organization. And so it became this kind of slippery thing it was dynamic, yes, but it was dynamic without any foundation. So it felt a lot more like, well, gosh, we were asked about that visiting policy 6 months ago, but I never really heard anything. I don't know if anything was taken into consideration that we moved forward. It felt like if the CEO changed, the commitment to the patient family engagement or patient family advisory program changed. If the project a quality improvement organization was working on changed, again, what the PFAC or the patient family advisory program looked like changed. And so this is why we are so passionate about infrastructure, because when you build the infrastructure, it is a road to sustainability and growth for the patient family advisory programs. It provides the infrastructure straight into, whether it's a project organizational chart or a hospital organizational chart, it brings it right into that organizational chart so that it doesn't depend on we've got this great advisor. We've got Marty Carney. She is awesome. That's all we need. Well, what happens if Marty wins the lottery and decides to move to Nantucket? And what happens to the program? It falls apart, right? That happened with the organization I was at. And so I really started to think about, how does the structure stay the same regardless of the people coming in and out? Patient-family engagement requires people coming in and out at a regular interval, not only the staff members, but the patient and family partners as well. So sustainability is a key benefit of infrastructure. It provides a really solid foundation for problem solving. And so when you put the effort in to figure out where your organization is as you're getting ready to launch your patient-family advisory programs, you have a solid foundation for problem solving. Things like charters are really important, because when you have an advisory council that maybe is drifting off track into a priority that the hospital is just not able to address at that particular point, you have a foundation for bringing it back. I'll give you an example. When I was on that PFAC early on, I fought for 10 years to get the parking fees waived at the hospital I was at. And then about, I don't know, 8-9 years in, the director of security came to me and he said, you know, Libby, I know you're really passionate about this, and I understand that it's really a burden on families to be paying for parking when they're coming to visit their loved ones. But I have to tell you, our entire security department's budget comes from the parking fees. I had no idea, right? So when a PFAC is going down a path that is, albeit very important, but going down a solution that has no basis in the organization, that solid foundation for problem solving, bringing things back to center, that's the reason for creating this infrastructure. When you create the infrastructure and it is in an organizational or project org chart, you naturally get more investment from the project team, from the organization itself. Lindsay will talk a little bit more about the need for leadership support and investment, and showing that that it is part of the organization as a strategy, not another program or initiative, is key to that. The other thing is, we know patient-family advisory programs change and grow. I mean, if they're really working, they're dynamic and they're growing. But infrastructure gives them the flexibility, the good, solid foundation to grow from, so that in essence, your North Star is still your North Star, but how you get there may grow and change over time. And then finally, what we've really learned with the tremendous support from our DEI work group is that creating infrastructure, we have to build a path for inclusion. We can't, it's not enough just to say we're going to be inclusive. We have to build a path for it. We have to build in translation services. We have to build in inclusion for folks who may have difficulty hearing or vision impaired. We have to build those pathways right into what we're doing in our patient-family engagement activities. So on the next, you're so good, Lindsay. Or maybe you're budging me along on time because you know I get passionate about this. So what we've come up with recently in the last couple of years is really starting to think beyond the patient-family advisory council. So those are fantastic functional structures within an organization, and this is not an either or, it's an and. And so what we've built onto the PFAC is this concept of no wrong door for patient-family engagement. So patients and families who are accessing services at a local agency or are the benefactors of research or what have you, providing multiple avenues for them to have input is an inclusive strategy. So building on the patient-family advisory councils, we're now encouraging some of our councils to get out into their communities to build that bridge and be those ambassadors to the communities. But we're also offering opportunities for quality improvement projects. So for instance, we've got a couple of advisors here in Los Angeles who are passionate about reducing sepsis because they have experienced sepsis. And so they are not attributed to a particular hospital or health center, but rather they are on a federally qualified, or I'm sorry, a federal QIO improvement program aimed at sepsis, aimed at reducing sepsis. So there's that connection. And you can do this at the hospital level as well, right? Patient family engagement can happen at, and should happen through all of your quality improvement and your safety improvement work. You can have patients and families engaging on project teams or time-limited committees. You can use high-tech solutions like surveys, listening sessions, focus groups. Use a listening session to develop a survey so you can get the insights of your broader patient population. So thinking really creatively and expansively about how do you bring in the patient family experience into the work that you're doing. So this isn't new work, it's a new way to do the same work. And it's a way that provides patient family engagement as a strategy for you to meet your goals. And so I would also just want to make mention here too, that I want to be, on the next slide, actually. I want to be really clear about the role of patient family advisors or patient family partners. We're kind of moving in that direction for the language. When I'm using that term, I'm thinking about people like myself who are using our lived experiences as the mom of 3 sons with mitochondrial dysfunction, using those lived experiences to improve healthcare together. We're really dedicated to that piece of together. So sometimes you hear the terms patient family advocates and patient family advisors used interchangeably. And I just would offer this little bit of insight of the way that we at PFCC Partners thinks about those two terms. Patient family advocates are essential to the health system. Patient family advocates, particularly in the safety realm, shine the light on errors, shine the light on the need for reducing hospital-acquired infections. They are the brave people who share their families' tragedies so that the health system learns and moves forward. A patient family advisor or partner really comes to the collaboration with our health systems without an endpoint in mind. And that's a key difference, right? Advocates are advocating for no harm in our system. Awesome. Advisors and partners come in actually behind that request, that light shine, to say, okay, how are we going to do that? And it's essential that we come to this work with open minds to collaborate and to learn together how we can move forward together, so that we don't come with that preconceived notion of how we're going to solve it, like I did with the parking fees, but rather we come with, this is a real burden. The parking fees are a real burden. How can we solve this with our patient or with our health system partners? So just a little bit of a nuanced difference between those two roles. They interact all the time. There's times where I'm a patient family advocate in my role. There's times I'm advocating for things. And there's times where advocates are partnering for those solutions. So it's interwoven, but distinctly different roles. All right, well, with that, I'm going to hand it over to Lindsay to walk us through the Readiness Tool.
Awesome. Thank you so much, Libby, for that background and introduction. I always think it's important to do some level setting so we're all speaking the same language as we move forward. So I'm really excited about the updates that we have made to our Readiness Tool. So we had an existing tool, and like Libby said, really recognized the need to include the diversity, equity, and inclusion lens. And we're extremely grateful and thankful for the DEI Leadership Council members who took their time, especially Patrick G, if he is on. He took a lot of time to really go through the entire tool and point out some really important aspects that were missing from the tool that we had been using for so long. So just wanted to thank the DEI Leadership Council for their help on updating this existing tool, because we had realized, it wasn't getting us to the DEI goals that we really wanted and needed in healthcare patient family partnership programs. So Laura put the link to this tool in the chat earlier. I'll ask her to do it one more time, but it is on our website and available to anyone, literally anyone, any healthcare team, researchers, hospitals, healthcare systems, anyone who is just looking for some of those first steps to start their journey toward a patient-family partnership program, advisory council, whatever it might be. And this tool will help you kind of think through, what do I need to get to the place where I need to go, where our organization is actively, authentically, and sustainably partnering with patients and family caregivers, all in an effort to improve. So the first part of the readiness tool is the organization's internal assessment. And these are some of the indicators for readiness. So if you can check these boxes, your organization or your team is ready to move to that next level of then actively, creating that infrastructure and engaging patients and families. So first and foremost is goal alignment. So looking at your organization or your team's goals and really ensuring that the goals that you have are closely aligned to how you plan to engage patients and family caregivers within those goals. And that's important for a lot of different reasons, but for one, as a patient family advisor, when I'm coming in to partner and I can see that I'm working on a project that is so closely aligned to the goals of the organization, I have more investment in that, and I can see myself really having an impact on those goals. And then for the organization as well, especially facilitators or just patient family engagement champions that are out there who are excited about patient family engagement and want to see it progress and move forward at your own organizations or within your own teams. Creating that alignment to the organization's strategic goals helps leadership to see the impact that patient family engagement can have at such a high level. And then there's the scope. So scope is really all about where you are going to focus your patient family engagement efforts. Are you a critical access hospital? It's going to start a patient family advisory council. Or are you a large health system who is looking to hold a series of listening sessions to focus on one improvement project? Are you a researcher who is, really focused on this one topic and wants to hold a few focus groups with patients and families? That scope is really important because it really informs all of the work that you do moving forward. So it's important to identify what the scope of your efforts are at the outset of your work. And then again, doing that internal assessment of the organization, looking at the staff. So how is the organization promoting patient-family engagement and getting staff interested in engaging patients and families in their own work as well? How are they helping staff to acknowledge patients and family caregivers as partners in care delivery, in their care team, and in improvement, in healthcare improvement as well? And how is the organization showing the value that is patient-family engagement? Are they creating opportunities for patients and family caregivers to be a partner in their care? Is that part of the culture of the healthcare organization that, a patient and their family caregiver are a part of the care team and should be actively engaged in their care? So looking at how the organization is valuing patients and family caregivers as partners. And then looking at the organization overall as well, when it comes to cultural humility, how is the organization helping staff, or how is the organization in general open to the fact that a person's culture influences how they experience healthcare? So understanding that each family, each community has its own culture, and that will really influence their experience in the healthcare system. So it's important to be open and learn and understand how that experience may differ depending on someone's culture. And then, is the organization prioritizing identifying social needs, challenges, and assets in the community? We recently had a workshop where Dr. Bruce Spurlock came and presented the Social Vulnerability Index, which is a tool that healthcare organizations can use to really understand at a deep level what those social needs are for any community surrounding a healthcare organization. So happy to share that and follow up as well. But just looking at if that is a priority to the organization. And then leadership engagement, and we got so many questions about this in the registration. So thank you all for your questions. A few things that are needed from leadership that you can see on your screen and are in the readiness tool as well. But that verbal and written support, the development of an action plan from the leadership, because with that verbal and written support and a plan of action to engage patients and family caregivers, leadership is able to remove barriers and then provide internal resources to any team that is, working towards their patient family engagement efforts. And is leadership committed to engaging diverse perspectives within patient family engagement work? And is there a willingness to change from leadership? The questions that we got about leadership engagement in the registration were, how do we encourage or inform leadership that patient family engagement is a good idea, or how do we get leadership engaged in patient family engagement? And so our team was brainstorming about this a little bit, and our first piece of advice is to find someone within the organization who has a real passion for patient family engagement. And this goes for, facilitators, pulling a team together, just finding those people who have a real passion for partnering with patients and family caregivers, whether it is in their care delivery or in improvement activities, but just finding those who are passionate about it and holding on really tightly, no matter what stage of your journey you are in. So maybe you're early on, this is just an idea, and you start to socialize it throughout your organization, and you find someone who kind of leans in a little bit when you start talking about patient family engagement or creating an advisory council. You want to hold on to those people because they can be really great resources to you. But finding someone with that passion for patient family engagement who also has a direct line to leadership, who can really be that conduit to provide them more information, sharing the value of patient family engagement and sharing exemplars from the field. And there are so many exemplars out there, and we're happy to help you connect if that is something that you would like to do, is start to put together, this organization is doing this and they have, really improved their outcomes because they are engaging patients and families. And also, Libby shared the National Academy of Medicine's community engagement framework. And that is a really great tool, to say, look, the National Academy of Medicine is talking about engaging the community. And, this is something I'm passionate about. We should be passionate about. We should be engaging our communities to improve, those social needs and the challenges that our community members have. And then also, if maybe you don't have that leadership support, and if you do not, you can run a small test of change to be able to get feedback and show value. So maybe your organization is working, or maybe you're a hospital and you're working to reduce readmissions. Are you able to put together a small focus group of patients and their family caregivers who have experienced being readmitted to the hospital? Can you have a small focus group and just ask a series of questions to gather more information about their experiences, their reasons for coming back to the hospital? Did they have everything that they need when they went home? Can you gather that information and be able to utilize that into any other work that you're doing to reduce readmissions at your hospital? So that small test of change, just to really prove the value and get feedback on it. So maybe that didn't work. Maybe you can try something else as well. And I know we have a lot of experienced folks in patient family engagement, and I really welcome you to chat in and share, some of the best practices or things that have worked for you or your organization to engage leadership as well. And I'm just taking a look at the chat. So Debbie.
Always learning.
Yes.
Yeah. Yeah, and Debbie had a question about sort of it. I think Debbie is maybe a patient family partner, and asking about how they get providers to see the true value of inclusion. Yeah, and I think, again, this is where infrastructure is so helpful. So I think that if your efforts are really tied to something that the hospital has prioritized, and whether that be because CMS has required them to prioritize it, or it's something that they're working on internally. But I think if you demonstrate partnership as a value add to the hospital reaching the goals that they've set, that is a really great place to start to build the value statement, really through proof is in the pudding kind of concept.
Mm-hmm. Yeah, and I think aligning patient family engagement to the topics and goals that are really important to leaders and to providers to show that value can be really impactful as well. And then I also see, Debbie, your question about compensation for the role of patient family advisor, which is an always evolving topic, and healthcare organizations across the country, across the world are all doing or all have different practices when it comes to compensation for patient family advisors. So I would say that is an evolution as well, especially if you're a new healthcare organization just getting started on this journey to patient family engagement. That may take time as you show the value as you progress through your role and the advisory council's role as well.
I would also make mention that is, that is, as Lindsay mentioned, something that's evolving, and we will be surveying the PFA network very soon about current compensation methods and how that's looking. So that I would say that needle is moving, but hasn't arrived in all places quite yet.
Yeah, absolutely. And I think Greg has shared a tool in there as well. So thank you, Greg. Yes, please feel free to share, even some of that. Oh my gosh, what was I trying to say? Proof. I can't think of a better word right now, but this is what other healthcare organizations are doing, best practices to help inform leadership as well. Okay, I wanted to also talk about the role of facilitator, or I know more recently organizations have referred to them as champions. So patient family engagement champions, or patient family engagement for equity champions. And for this role, it's really important to think inclusively because representation does matter. And when you have someone who is in the role of facilitating an advisory council who, looks like the community that organization or that team serves, you are more likely to be able to bring in more of that community whose voices you really need to make a change within healthcare. So thinking really inclusively, and someone who is able to have that change-making authority or that line to leadership as well is extremely important to be successful with patient family engagement for any organization or team. And Libby, you had some additional thoughts about, the role of patient family engagement facilitator within the organization. Who is that? Who does this work?
Yeah, and it really can be very different in each organization. So I think that the default over the last maybe handful of years or so has been to patient experience, which is great. It's a wonderful lineup to that organization or that part of the organization. But I just want to, again, push your thinking outward a little bit to think it could also be your quality improvement director or the quality improvement department. It might be, in the case of measure development teams, it might be the lead for a singular measure that's being developed. In the research teams, I serve on a couple different research teams, and on one, we are co-PIs, right, even with the principal investigator. And on others, it's under the education arm of that particular research team. So think really expansively about not so much where does it fit, but really where does it fit as a program, but where does it fit as a strategy? Where are you trying to get improvement? Where are you trying to create change? That's where it really can be most beneficial. And so I would just encourage you to think broadly and not limit yourself into some of the more traditional places that the patient family advisory programs sit, but really allow it to be a strategy that can be implemented across your organization or project.
Absolutely. Thank you, Libby.
Mm-hmm.
All right. So I also wanted to talk about the team because, not one person can do all of this work by themselves. So it's important to pull a team together that can support you. And so again, I have the point there, inclusion through representation. So those that you are pulling together on this team to help move your patient family engagement goals and efforts forward, ensuring that, they are also representative of the community and the patients and family caregivers that your organization serves. And thinking really broadly about representation. So of course, race, ethnicity, age, 65 plus, people with disabilities, socioeconomic status, just really thinking broadly about how representative that you want your patient family engagement or patient family partnership program to be, and be able to bring in some team members that are also representative. We have a National Patient Family Partnership Council, and one of the members joined and said, it's hard for me to see myself as part of this team when I'm looking on a screen of all Caucasian people. So that representation is extremely important. And that is one of the things that the Diversity, Equity, and Inclusion Leadership Council really helped us to identify, that this is really important for organizations to incorporate into their patient family engagement strategies at the onset, when it is just an idea. So definitely a big improvement to the Readiness Tool. But also a team that is, committed to the process, because it's not easy work, but it is a new way to do the work that you're already doing. So being committed to learning and making mistakes and changing your processes, but always sticking to that infrastructure that you have. And then another item that we added, and I think this is important for beyond the team, but the facilitator, leadership, really anyone within the organization, is examining your implicit biases. And we had recently worked with Adventist Health. We actually are still working, helping them develop a few patient family advisory councils, community advisory councils. And they went through the process of taking the Harvard implicit bias test. And then we got together and had a conversation about, the reflections that they all had after taking a few of those implicit bias tests. And I believe I saw Edward from Adventist Health Tehachapi Valley join us. Edward, are you on?
I'm on, Lindsay.
Hi, Edward. Thank you so much for taking time to join us. Do you mind introducing yourself and then telling us a little bit about your experience of doing the implicit bias test with your team and what you all learned together?
Okay. Well, good afternoon, everyone. I'm not quite sure where everybody's dialing in from, but my name is Edward Martin. I'm the Administrative Director of Operations site administrator for Adventist Health Tehachapi Valley. We are located in Central California. We're part of a much larger healthcare network of hospitals falling under the umbrella of Adventist Health. Our hospitals kind of span all of California, and it expands even out to Hawaii. We have about 23 hospitals within our system. So we're a fairly large hospital, fairly large system. However, my hospital is a critical access hospital. And so we're based in the mountains of Tehachapi, beautiful community. So as Lindsay mentioned, we've been actually on this journey to become a PFAC council, Patient Family Advisory Council. We realized that, you know, one of the easiest ways to impact or positively impact your patient experience is really through the establishment of a Patient Family Advisory Council. And here in Kern County, well, not really even Kern County, for Adventist Health, they're having me and my team, we're helping to kind of spearhead a lot of the efforts to establish our, instead of calling them PFACs, we're calling them Community Advisory Councils. And so far, Lindsay has been extremely gracious to be able to take us through the lessons. We've been going through the gateway chapters. I believe we've covered already chapter 1 and chapter 2. I have found it to be incredibly insightful. We will be, of course, moving into chapter 3. But just as Lindsay mentioned, one of the assessments that we were actually given was the Harvard Implicit Bias Test. Now, I would consider myself to be a pretty well-rounded, lovable individual. I feel like I've traveled quite a bit, and I feel like I connect with all people, all cultures, all forms of thought, until I took this test. And I think what the test does is the test really helps to address some of those unconscious biases that we actually have. And I remember as I was kind of going through it, I mean, I shed a tear a couple of times because I couldn't believe that there were areas of my life that I actually had biases. And to me, you know, in speaking with some of my team members, and they were going through it as well, many of them coming from different backgrounds, different religious beliefs, different cultures, different ethnicities. And they also believe that they were pretty well-rounded and accepting of all people and all thoughts. But once they actually took it, I think what it did is it really kind of provoked thought as to areas within our lives where we really need to, areas within our lives that we didn't realize that we were biased towards certain maybe groups or thoughts or individuals. But I think that's important because as we head into our Community Advisory Council, the composition of those councils, especially with our patients and families, are going to be composed of all walks of life within those committees. And it's so important for us to understand that as we begin to engage with these individuals, that we don't allow, that we're fully aware of what our unconscious biases are so that they don't pop up in the conversation. And so I really appreciated that. I don't know how many individuals on this call have been able to go and take it. I highly, highly recommend it, even if it's just, you know, what are the things that I tell my staff, as well as my, as well as certain family members, even though I don't think the family members really listen to me much, but one thing I oftentimes tell my staff is, you know, the best gift that you can give yourself is to know yourself. And so, so this test right here is a great way to peel back some of our shell and actually get to the core of who we truly are so that we know how to properly address it. So thank you so much, Lindsay, for taking us through that. Sorry for taking up too much time.
No.
But,
No, I really appreciate you taking up all that time, Edward. You can take more if you want to. I think the best way for us to learn is through, peer sharing. And so I really appreciate you sharing, what you learned and how, especially taking that implicit bias test will impact the way that you get to partner with your community moving forward. So really powerful. And I'm taking that quote and holding on to it as well.
Lots of truth in it.
Absolutely. Absolutely. Libby, did you have another question or anything to
No, I'm just sitting here in full admiration of Edward's comments. So thank you so much for joining us.
Oh,
Yes.
thank you so much, Libby. And thanks so
you.
much for inviting me onto this call.
Anytime, come anytime you want.
Exactly. I mean, it really is. It's so great for people to hear from someone who's kind of going through this process and benefiting from the Readiness Tool and the Gateways program and really looking at setting up that infrastructure. It's just so helpful to hear that fresh perspective. And I think Edward is also just such an example of what we really want to see in a facilitator and coordinator, and that is a natural passion for people and for connecting. And I think your passion is infectious to me. It's infectious to everybody else on the call. And so I'm positive it's infectious at your own organization. And I think that sharing, that ability to share your enthusiasm for this work is really an essential attribute of a facilitator of patient-family partners.
Thank you so much, Libby. I mean, it's been definitely quite a journey. We've actually completed. Let me say this: we've technically completed our charter, and with our charter, we've already established our mission statement, our vision, the strategic functions, responsibilities, and the composition for our leadership as well. What we're currently working on right now is what that online application portal is going to look like. So we want to make sure that we make it as easy as possible for our community and patients to be able to go and sign up if they want to become a part of the council and to share their lived experience with us. So we're excited about this journey. We have a lot of individuals that are very passionate about this work.
Yeah.
And we have a multidisciplinary team that's actually part of those discussions. And so again, we're really looking forward to actually see what the outcome of this is.
I know you'll be successful. Yeah.
Yes, I'm confident it will be very rich.
Exactly. Yeah. Thanks so much, Edward. And I think, yeah, that's a great segue to just one of our last points here is looking at those internal support resources. So looking within your organization at the people, those who are really passionate about patient-family engagement, the units and departments that are available to you. So encourage all of you to just think really broadly about who might support your effort within the organization and what resources are readily available. For example, we're also partnering with the Los Angeles County Department of Health Services, and we have really leaned into the resource of their Language Access Center. They help to revise our communications that go out to our Patient-Family Partnership Hub or community of patients and families within LA County Department of Health Services. They ensure that the language is accessible. And then they have also helped us with translating to Spanish and provided interpreters for our monthly meetings there. And that was all a resource that was available within the organization. So, really think broadly about all of those resources that you can lean into, whether it's those who have strong connections to the community that can help you recruit patients and families for focus groups or listening sessions, or your advisory councils, the volunteer department who has a lot of good information about your organization that they can provide to the patient family advisors. So thinking really broadly about all of those internal resources, marketing and communications to help you communicate out. There's so much that is readily available to you to support your patient family engagement efforts. All right. So we heard from Edward. So thank you again, Edward, for joining us today and sharing with your peers here. We have about 4 minutes left. I wanted to leave more time for questions, but a lot of information to cover today. So thanks for hanging in there. So please let us know if you have a question by raising your hand, or you can put those in the chat. I think we answered the questions in the chat, but I'll lean on Libby or Laura to see if there's more. Harvey, I see your hand up.
Just one comment, the reworking of the Readiness Tool with all the bullets coming out from it was a fantastic update, wonderful work. Just want to go back to one thing you talked about earlier, the leadership engagement, willingness to change, and without all of the biases in leadership and or those that have been in hospital organizations, I'm speaking from hospitals specifically, that haven't been able to realize their biases and accept change. You know, the Readiness Tool, I feel like so many of these things, you're just up against a wall. In the last 2 to 3 years, hospitals, staff has changed dramatically. What I read this morning from Kaiser Health News about hospitals all across the country, not just in the area where they are, going out of business. Healthcare, as we all know, is a money business and money driven, but it's not going to stop me from being a patient family network individual and fighting the fight, because that's what it is.
Thank you,
Thank
Harvey.
you.
I think I appreciate your comments. I think, you know, we certainly, after the pandemic, are challenged on many, many levels, as are our healthcare partners. So I think it would be, it's really beneficial for us to think about fighting together and not fighting each other, not fighting health systems, but rather how can we support workforce wellness? Because our workforce, our healthcare workforce really had a difficult couple of years. So, you know, thinking
Yes.
about ways that we can be part of the solution, I think is really what we want to focus on. But thank you.
Agree. And I'm glad that the PFA network has grown to over 800. Amazing.
It is amazing.
Thank you.
Good
Thank you for your
people.
work.
Absolutely.
Yeah, great point. And thank you for that question as well. All right, so we have about 0 minutes left. Right as I said 1 minute, my clock changed, but please, if you have any additional questions, you can put them in the chat. I'll leave the meeting open for another minute or two, but also please feel free to email us anytime. You know, like Libby said in the beginning, we are thrilled to be able to make opportunities like this and develop resources like the Readiness Tool at no cost to all of you, because we really want to see more more patient family engagement out there wherever we can. So yes, thank you all so much for your time today. Thank you again to Edward. I know he had to drop off, but we really appreciate it, and we hope to see all of you here again next month or at another activity in between now and then. And thank you, Libby, as well, for joining and sharing with our community here. Always learn so much from Libby and all of you. So thank you, and have a wonderful weekend and happy Friday afternoon.
Thanks,
Take care,
everybody.
Thank you.
Bye, Marty.
Hi,
Bye-bye.
this was great. This was
Thanks.
great. Totally recharged.
I saw your note. I'm glad.
Nice.
Yeah.
You deserve
Yeah.
it.
We all need a little recharge every once in a while to get excited about the work that we get to do.
Mhm. This is the group to recharge with because everyone understands. It makes a big
Mhm.
difference.
Yeah.
It does. You're right.
Great point.
None of us will give up. That I know for sure.
Mhm.
It's true.
Yeah.
I agree.
Thanks,
Second
Rosie.
that.
So have a nice weekend and
Thanks,
too,
you guys
Rosie.
too.
Stay well.
All
Bye.
right.
well.
Take care,
Bye-bye.
everybody. Thank you.